Good evening, everyone. I'm officiating tonight, so bear with me. I'd like to call the Radnor Township Meeting Board of Health to start. Okay, I guess we'll start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, welcome everyone to our meeting tonight. I wanted to look at the review and approval of last month's meeting minutes, April, if everybody had a chance to take a look at them.
Would you like a motion to approve?
Motion to approve. Any additions, corrections, changes needed? One approval? How many do we need?
No, all in favor, right? Yep.
All right, great. All right, thank you. So we move to approve the April 17th meeting minutes for the Board of Health. Thank you very much. Larry, would you mind giving us a health officer's report, please?
Yes, ma'am. Good afternoon to the board members, both Board of Health members and the Board of Commissioners that are here tonight, and the people at home watching the meeting. Under activities, Maria and I did 38 food safety inspections, which 2 are attributed to 2 temporary events, which were the Katie Sampson lacrosse tournament and the Wheels of Wayne. We vetted 13 food vendors for these 2 events. Did 8 bathing place inspections, 9 quality of life issues during that month. I wanted to bring your attention to upcoming training, where our 21st Annual Workplace Safety Committee will be Friday at the Springfield Golf Club. It's a committee that we will have for the township that helps keep our insurance premiums low by us reviewing near misses, accidents, and things in the workplace. Also, we also have upcoming Pennsylvania Department of Agriculture retail food safety training in June the 13th and the 14th. The past Monday, I think it was the 9th, or Tuesday, we had the Carol Axelrod blood drive here at the township, and we have an upcoming Wayne music festival, which will be June the 10th of 2017. We have a couple of new food facilities that are open in the township. Dan, which is at 214 Sugartown Road, is now open. And From the Boot, which was formerly the Vecchio Pizzeria on North Wayne Avenue, it's now open. We have a few others that are under renovation. In your packet, you'll find a special invitation from Lacanau Medical Center for a groundbreaking ceremony, inviting the board to the Board of Health members to the groundbreaking ceremony. And also there's one Pennsylvania Health Alert, or rather advisory, number 373, recommendations for diagnosing and managing Shigella strains and possibly reduce susceptibility to, want to say that word for me? Ciprofloxacin. She's a nurse. Madam Chairman, ciprofloxacin.
Yeah.
So ends my report.
Thank you very much. Excellent. So were we going to do something with the presentation about typical food inspection, or did you want to wait to discuss that later? Pardon me?
We'll do it.
Okay, great. Thank you very much. So Dr. Foreman had requested last month to give some information regarding what's involved with a typical health officer's food inspection, and Larry has agreed to give us some information.
Find my presentation. Will you use yours?
Yeah, I'd like.
Okay, Want to do it from here or up there?
We'll do it up there.
Okay, so good evening. We're going to give you a brief summary of food safety inspection.
First of all, I want to give you a little general information. In the Commonwealth of Pennsylvania, food safety inspections are conducted by different agencies: county health inspectors, local certified health officers, and the Pennsylvania Department of Agriculture sanitarians. The Commonwealth of Pennsylvania also has 67 counties with only 6 that have a county health department. And in addition to those, there are 4 municipal health bureaus. And the Pennsylvania health departments are Allegheny County, Bucks County, Chester County, Erie County, Montgomery County, and Philadelphia County. The municipal health bureaus are Allentown, Bethlehem, Wilkesboro, and York City Health Department. County health departments and the municipal health bureaus conduct food safety inspections within the county or municipal jurisdiction. Where none exists, the food safety inspection is conducted by a local certified health officer or the Pennsylvania Department of Agriculture. When inspecting the food establishment in Radnor Township, we generally keep in mind 4 categories: physical conditions, employees, people, equipment, and food. We'll briefly talk about each of those points and give some specific criteria that falls under each category.
Okay, physical conditions. Prior to visiting the food establishment, we may review previous food inspections to gather information on past violations or key points to focus on. On site, when we arrive at the location, we are taking note of pathways and any trip hazards in or around the entrance. Upon entering, we look for the non-smoking sign that references the Pennsylvania Clean Air Act. Once inside, we know general cleanliness of the dining area. We scan conditions of the floors, the walls, the ceilings. We're looking for smooth, durable, non-absorbent, easy-to-clean surfaces. Proper lighting is also important in food prep, so we make sure no light bulbs are out. Each bulb has some plastic shielding in case of any breakage to prevent any physical contamination of the food. With this, we look for signs of any insects or rodent infestations. If there's no evidence of any obvious live pests, we ensure the food establishment is working with a licensed pesticide operator. And we look at people or employees. So while inspecting the people in the food establishment, we observe for those wearing proper hair restraints, including beard restraints. Employees should have no signs or symptoms of an illness and have a clean appearance and clean uniform. No jewelry apart from a plain band on one finger for food prep employees. We're observing no bare hand contact with ready-to-eat foods, proper hand washing, correct procedures for preparing foods. Each establishment should have a certified food manager. If the manager is not on site at any time, there should be a knowledgeable person in charge. The CFM certificate, the food license, and the current food safety inspection report should be displayed in the food establishment for easy public view. A little bit about equipment. All the equipment used to prepare food should be clean, commercial grade, and have adequate temperature monitoring device where needed. Ventilation systems should be inspected yearly. We look for air gaps to prevent back siphonage. Proper sanitation procedures should be demonstrated with the sanitizer identified and the correct concentration tested with its corresponding test strips. Mechanical ware washing or dishwashing should be proven to reach the appropriate temperature for sanitizing, which is 180 degrees. Mop storage areas should be clean and free from miscellaneous items. Water buckets empty when not in use. Mops hung off the floor, handle up to make sure they're drying properly. Employees, the employee and the food establishment restrooms are inspected for cleanliness, door locking, being properly stocked with soap, a drying device, or paper towels and toilet paper, and there must be a sign for the employees to wash their hands before returning to work in each restroom.
Food. We monitor cooking process, along with verifying thermometers are being used often and appropriately, and by taking temperatures during cooking, holding, and cooling, especially with time-controlled substances foods. or which we used to call potentially hazardous foods. We also validate the techniques for microwave cooking, reheating, and slacking of foods. We will monitor the time, temperature abuse, and proper recording when using time as a control. We ensure labeling and dating are current and easy to read. Storage rooms shall be clean. Items stored 6 inches away from the wall and the floor. Canned food shall be intact without denting or bloating. Cold storage should demonstrate first in, first out method, as well as storage by cooking temperature, meaning the lowest required cooking temperature stored above the highest required cooking temperature. Report. Once the inspection is complete, a three-page detailed report is done on site. We then sit with the manager or person in charge to discuss the findings of the day. A copy of the report is given to the food establishment and filed with the township, eventually available on the website for public view. In conclusion, food safety inspections can take anywhere from 1 to 3 hours, with our goal to ensure the establishment provides safely prepared food to the people in Radnor Township by means of monitoring and educating the food employees in each food place. Every food safety inspection is different, depending on the type of the food facility, size of the operation, menu, and staff cooperation. Except for a new food facility that are scheduled inspections, all other food safety inspections are unannounced and occur upon arrival. The goal is to inspect each food facility at a minimum of once a year, with all schools being inspected twice in the school year. This does not include needed follow-up inspections. It should be noted that any food and safety inspection is only a snapshot of how food establishment is operating at the time of the inspection. And at any time during the inspection, the health officer observes circumstances that may endanger public health, may order the food facility to immediately cease operations. This is a summary of what is looked at during a food safety inspection and completes this presentation. We now take questions, any questions you may have.
That was excellent. Thank you very much. My goodness, I didn't realize there was so much involved. One question I have, so if the public was interested in looking at a food inspection of a particular restaurant, where would they go? Would they look in the township website, or where would that information be available?
It's 2 places. If they're at the restaurant, the food safety inspection report should be at the restaurant. There should be either the inspection report available and posted, or a notice that its availability is there for them upon request. If they're at home, they can look on the Radnor Township's website at www.radnor.com, go to the front page and click down the food inspection reports.
So I just Googled food inspection Radnor, PA, and the first thing that comes up is food establishment inspection records Radnor, PA. So I think you should be congratulated. And when you click on that, you can literally go through a number of restaurants in the community, which I won't name, but you can go through there and scroll through and find the latest inspection report. And I think that's a real improvement and something that, I think you should be very proud of. And I think the township residents of Radnor are very appreciative of being able to do this. You don't have to go to the establishment director and ask them for a report, right, which is kind of hard to do. But you can search that restaurant and make sure you do it. The only question I had was, let's just say a township resident sees something that doesn't seem right. What's the process they should go about in terms of letting the board know that there's something that we should investigate?
That's very simple. They can either call Marie or I, or send us an email.
And that email is just on the Board of Health website?
It's on our website, yes.
Perfect. Thanks again, Larry.
Great presentation, and thanks for the explanation. I didn't really realize how involved the inspections are and how detailed. I have 4 questions. One, how long does the average inspection take? Second is how often for each establishment? The third is, are they always unannounced? And the last question is, what's a certified food manager?
If I can remember all them. A certified food manager is a person that's trained in food safety by a nationally recognized organization such as National Restaurant Association, Prometrics 360 training, but it has to be nationally recognized. In fact, we have one here, but I promise not to embarrass her. What's the second thing?
The food inspections, how often and how long?
An inspection typically takes on average between 1 and 3 hours. It depends on what we find when we go in the door. And how much cooperation we get. Because that inspection has to occur.
And how often are they done for each establishment?
At least one time a year.
Okay. And
Generally unannounced.
generally unannounced.
The only time that they're not unannounced is if it's a new facility.
And I was impressed the time Larry and I went out to a food inspection, and people will offer him drinks or whatever food, and he is not allowed to do that. But
No, we don't do that.
I never thought of that, but it could be biased, so.
We don't do that.
What's your thoughts on requiring a certified food manager to be in the building during hours of operation instead of somebody that's just knowledgeable? And I guess my follow-up question is, who determines if they're not knowledgeable enough to be alone in that building to oversee food safety operations?
My personal thoughts on him being there, or what the code requires?
Sure. Well, I know what the code is.
Yeah, and as a regulator, I kind of stick with what the code requires. I try not to put my personal opinions in there. And the code requires that they have to have at least one certified food safety manager available. And that, according to Pennsylvania Department of Agriculture, that availability means that they can respond to the store within an hour, hour and a half. The only place that requires more than that is Philadelphia.
So, to my point, if there's someone on site, that's not a certified food safety manager, how do we know that they're competent to oversee that food establishment and maintain, the food safely?
Well, that's a question that's pretty difficult to answer. I mean, I would have to be.
I know.
I would have to be in that facility all the time to be able to know that, and be able to question on their operation, on food, on time and temperature of use, cleanliness, physical facilities. I would have to be able to be there a while to do that.
So what the point of the question is, we spend a lot of money and training and man hours on getting people within my organization certified as food safety managers. What we've done now that we have full coverage, we do operate in Philadelphia, there is always a certified food safety manager on duty. However, with some of the people that are not certified that oversee some of our operations within the establishment, we thought to ourselves, well, how do we know that they're qualified to oversee this operation? So we started asking questions. Now, some of these people have been, this is just my experience, have been around for a very long time, and they know how to cook, but they don't know anything about food safety.
I agree.
And it's very concerning. When me and Larry went out, and when I heard that, Philadelphia is one of the, if not the only municipality in the state that requires a food safety manager on site during all hours of operation,
They're the only ones.
I was a little shocked by that. As you guys now know, there's a lot that goes into this. The test itself is a 30-hour course to be certified.
It's a 15-hour course.
15-hour course, and then there's an off-site assessment, right? You have to do a test and it's administered from a...
It gets sent back to Chicago.
Right. So there's a lot that goes into it. I guess that's my point. And I don't want to reinvent the wheel with the rest of the state of Pennsylvania, but, from my experience where the city of Philadelphia requires that somebody is on site, and I'm going around and I'm talking to people that are not certified, even though that person's in the building, it's a little dicey sometimes. Just saying.
I agree.
But as of this time, Larry, the code states that they have to be available within a certain time frame, and they have to have a name of a person
Correct.
at all times. So we could theoretically assess at a visit, that they were able to furnish at the time of unannounced assessment a person that was available, and that person could be contacted, and you could ask them to contact that person while you were there as a measure of compliance with the current code. I agree with your points, and certainly very valid points, and really, concerning things. But at this time, with our current code, do you feel, Larry, that we could maybe put in an assessment or make sure that that's not, I assume that's already being done to some extent, to confirm that they have those folks already on the books and that they're available in the time frame that the code requires?
Many times we have done that. That exact same thing. Any more questions?
Thank you very much. It was very thorough.
Thank you, Larry.
Excellent. I learned quite a bit, so thank you very much. To move on to some old business, I wanted to touch on the Villanova construction update. I know there was no meeting in May. There's a June meeting scheduled for Thursday, June 1st. Any word, Commissioner Nagel or anyone, on any of the soil sample results? Has anybody heard anything?
They'll be in for your meeting next month.
I can't remember where I laid my presentation.
Yeah, Phil asked me to mention that the CARE Committee's next meeting isn't until June, and right now it conflicts with the zoning hearing board as far as this room. So he's trying to look for a rescheduled date for that.
For the CARES meeting? So that'll be on the website once it's announced?
Oh, absolutely.
Okay. And maybe somebody, you could email Dr. Foreman or I, and then we could distribute if it's before the next meeting so we can have representation.
I'll ask Phil to do that.
Thank you.
Is the Board of Health going to review these samples before they're published? Is that the plan?
I haven't thought of that. I mean, I would hope it'd be transparent, and once it becomes obvious what it is, it would be public information.
And it doesn't need to be tied to the CARE meeting either, so we're supposed to be mid-May. I guess it's mid-May right now, so this is something that I had asked for and very anxious to get whatever we can because the construction is moving forward, so it's kind of, we need, let's get the data that we have and let's get it published, so. I'll assist John to make that happen if I can.
Great, thank you so much. That'd be good. As far as the final student presentations will be in June, so Ming John and Joanna Vines will be presenting at the next meeting. And if you have any questions, you can reach out to Dr. Schartz-Hopko or myself for any clarification or help. We'd be thrilled to help you. The teen sleep recommendation was sent to the school board president, superintendent. I got an email from Dr. Foreman, and it's the response from the Radnor school. It was sent to the superintendent, and Dr. Foreman plans to go to the school board to discuss this on May 23rd. So we all agreed on the new teen sleep recommendation for school start time at 8:30. So he's going to go and present that. And it was a thoughtful letter from the superintendent. He did say that there's been a lot of discussion in this topic and research in many other districts. There have been some districts local to us that have delayed school start times to 8:30, so more to come on that. For new business, public input from the Valley Forge Military Academy Health Fair, Mr. McCaffrey. If you want to give us an update.
I'm a bit embarrassed. I had the intent of operating as a member of the Board of Health there, but it turned into me just exchanging war stories with a lot of the people. I did introduce myself as a representative of the Board of Health, but most of the conversation was about the Marine Corps or the Army or. So I apologize. As a formal public apology. We discussed the military more than anything else. Everyone there seemed very fit, and that's my only feedback. Sorry.
That's a pretty common experience when you go to these public events.
Every intention.
Okay, just to announce, in June, it's going to be our final meeting till September, so just wanted to let the public know that. To note, there's a speed limit change on Bryn Mawr Avenue. Mr. Crody, did you want to speak to that? And I know there was something about some closures or something going on.
Yeah, PennDOT, and what I see as a repeated pattern on their behalf in not optimizing the communication with the communities that they impact on. And it may be a bit of a stretch, but I do think that the speeds up and down Bryn Mawr Avenue, the closing of Bryn Mawr Avenue or not, are potentially have some fairly significant impacts upon the health and welfare of the community. And you know, I have an old beef with PennDOT about access ramps, handicapped access ramps that lead to nowhere and cost us hundreds of thousands of dollars. They come back again and fail to communicate in any way with anybody in Cornerstone or anybody in Foxfields, which is where I live, in Ward 5. We woke up one morning, I think it was the 17th of April, to find that the speed limit had changed overnight, literally from 40 to 35.
Was that on, was it, just to clarify, so the speed limit, so it was, they took the signs down and?
Yeah, so there's two issues here. One is the speed limit change overnight. As far as the residents in Foxfield and Cornerstone, those are the only ones I've checked with, there was absolutely no communication whatever between the residents and the whoever made the changes, PennDOT or Radnor Police. I made some inquiries about, okay, what's the basis for taking it from 40 to 35? Maybe why change it? Why change it at all? Why not down to 30? Has anybody studied this? I was assured that yes, PennDOT had studied it, and under access to, what is it? What do they call this thing? Right to know legislation. I submitted an application, could I please see the study? As far as I have been able to determine, not only was I refused access to the study, nobody in Radnor Township has seen the study. This is the study that PennDOT did to confirm the wisdom of making a change from 40 to 35. I would love somebody in Radnor Township to see that study, to know what kind of improvements in terms of the number, the frequency, and the nature of the accidents that drove this change. So let's just see some substantiation for an overnight change in speed limits. Let's see some communication between PennDOT and the community. If there is a study, who gets to see it? If I apply formally, going through all of the appropriate procedures and get told, no, you are not allowed to see that study. Who can see the study? Is there such a study? I suspect, candidly, that there isn't a study, and this was done overnight. But that doesn't seem to me to be a great way for PennDOT to be working with the community. And again, as I say, it's a bit of a stretch of the Board of Health, but that 2 miles from the Wawa on Haverford down to the 320, probably a fair number of accidents there, probably have a fair impact on the community. We shouldn't just wake up in the morning and find that things have changed without any input at all from or with the community. And the same sort of PennDOT failure to communicate or refusal to communicate or total disinterest in communicating with the community was behind us waking up, I think it was a couple of days later, John, and found a notice telling us that within less than 2 weeks, South Bryn Mawr Avenue is going to be closed, completely closed from where South Bryn Mawr goes under the 320. It's actually over Ithan Creek. Here's the notice. It's closing. Dig a little deeper. Yes, it's going to be closed until sometime in the middle of August. almost certainly a deadline that they would not keep. PennDOT, on further investigation, John confirmed that PennDOT had given him a commitment a year ago, John? Year and a half ago, to keep the road open while they worked on this little bridge. But apparently they're ready to renege on the deal. And I don't think, John, if we hadn't got Alex Charlton involved, I don't know if we would have gotten any joy out of PennDOT. But PennDOT, again, failure to communicate. They withdrew the plan to say, you know, we're not going, they've withdrawn. They said, okay, we're not going to go ahead. We'll go back to the drawing board. I have no clue, and I don't know if anybody in the township has any clue when this bridge work is going to be done, how it's going to be sequenced, what the impact on the community is going to be, where all the traffic is going to be rerouted to. The reroute that they had proposed for the May 1st shutdown was a farcical reroute. It made absolutely no sense. So the issue is PennDOT and their failure to communicate, and the likely consequences to the community, not just where I live in John's ward, but more broadly when they shut down major roads like this without any communication at all. How do we get from them a copy of a study that says a reduction from 40 to 35 makes sense? What are the benefits? Has anybody quantified the benefits that are going to come from that now implemented change? Let's have a look at them and let's hold somebody accountable to delivering against those benefits. And if you're not going to go ahead with the bridge work on the 1st of May, when are you going to go ahead, and what is your plan to deal with the closure for what's likely to be 4, 5, 6 months? So how do we get some answers from PennDOT? How do we get some communication from PennDOT? How do we get two-way conversations going, John?
Well, as I explained to all the constituents, PennDOT being a state agency, the best thing to do is to deal with our state reps and our state senators. And as you saw, that had some effect. They're really two separate issues, and I think we need to break them. We were successful convincing PennDOT to reschedule the bridge work the way it was originally proposed to us, by not only discussing the fact that it's 12,000 cars a day that go up that road and the inconvenience to the folks that live right there, but also we all know from practical experience that no one's following their recommended routes, so they're going to be coming through the neighborhoods. We also gave them a count of the number of emergency vehicles that traverse Bryn Mawr Avenue every day. And I think a combination of those effects allowed them to see the wisdom of returning to their regular plan. That meant, though, that they had to go back to the drawing board and resequence some of the work and develop a new work plan, and they haven't told us yet when the work will begin. They will maintain 2 lanes open, 1 in each direction. They will be cattle chutes. You're all familiar with them, where they put Jersey barrier up, and they will be 10-foot lanes. But generally speaking, rush hour is already backed up all the way to Mill Road, so that won't have any effect. It won't cause additional slowdowns, in my opinion.
You don't think, John, that the consequence will be that the backup will be from not to Mill Road, but all the way back up to maybe the Wawa?
No, I don't.
Well, where's the traffic going? If you're closing the bridge,
you're
narrowing the bridge,
Paul,
where's the traffic going?
Excuse me. You're not closing the bridge. The bridge will be open. It's just that taken off rush hour time when someone is speeding down the road, which your other issue, they do, well, when they get to that area, they're going to slow down. So that's where the impact really will be of this construction. There'll be some shutdowns, and we've asked them to schedule them all during evening hours. to relocate the cranes and the work, to develop the work site. We're working with them now to try to figure out what they're going to do with Ithan Avenue, because Ithan Avenue comes out right at the bridge. So there's some potential issues there, and Public Works and Engineering is working with them on those. On the speed limit, again, PennDOT. The problem with PennDOT is they aren't given enough money to do everything that needs to be done, so therefore they have a certain amount of control in what work they decide to do. So that's why the political process becomes very important. But as far as there are numerous complaints I had over the last several years about the number of accidents on Bryn Mawr Avenue, which is excessive. Right at my corner, there are at least 3 or 4 accidents a year. Folks asked me what to do. My advice was talk to, in this case, it was Bill Adolph. PennDOT then reviewed the accident data for the street, made recommendations, and then notified the township the township physically installed the signs, but they were directed to do that by PennDOT. In addition, the street where I live is now on no turn on red. So they were the 2 actions that resulted from citizen complaints. Now, I don't know if they did a study. I agree with Paul. I doubt it. They probably just used, hey, we'll lower the speed limit, that'll help type logic. I don't know about you, anyone who drives over there. I've been passed on Bryn Mawr Avenue, so it's incredible.
Can I just summarize for a second, because I'm trying to take notes here. So the bridge will not be closed, there'll be limited access to traffic during certain hours a day. Is that your understanding?
It'll be restricted to 2 lanes.
To 2 lanes, okay.
That bridge is actually very wide.
Okay. And second, the speed limit change and the no turn on red is a direct action of a complaint from the increased number of accidents on that avenue, correct?
Right.
Okay, thank you. So is there any other help that our board can do? Because it sounds like they've responded to some citizen complaints about accidents.
Well, the point is, I think that Paul's making is the real lack of communications.
Okay.
It's
Okay.
not reassuring to wake up, if you live just off of South Bryn Mawr Avenue, which I do, my house is 1 in from South Bryn Mawr Avenue, at probably, where speed is maximized by folk coming down that road. It's good to know that PennDOT is doing something about that, but it would be much nicer to know, what is the logic behind the reduction from 40 to 35, and what will the benefit be? And if we're told that there's a study, and we're told if you want to see the study, you will have to apply for it, and going through the proper procedures, then to be told, no, you can't see the study. Is there a study or is there not a study? If I, as Joe Public, can't get access to that, can at least this board, with its concern for health in the township, be told there is or there is not a study, and can anybody see it? It's not a responsible way to run something like PennDOT. It's a failure to communicate. It's unilateralism. It just doesn't seem like good community involvement.
And I think my concern is, outside of Radnor Township on College Avenue, that bridge is taking forever. So I have no idea how people would get from one side of 320 or Newtown Square over to Haverford Avenue or Route 30 if Bryn Mawr Avenue was closed.
The proposed route for people who were going to come along South Bryn Mawr Avenue from, say, Route 3, heading towards Bryn Mawr Hospital, hopefully not in an emergency. The route proposed by PennDOT was to turn left up the 320, keep going until you hit the Lancaster Avenue, turn right on Lancaster Avenue, go along Lancaster Avenue until you hit County Line Road, up County Line Road, and take a, where do you get to? Slight left to Bryn Mawr Hospital, it's more than twice the distance. You've gone from just under 2 miles to about 4.5, 5 miles. It's an absurd proposition, which is why John said, no one's going to do it. They're going to cut through little residential back roads, side roads, and that's where you're going to get your accidents. That's when, health and welfare takes over from law and order.
So my only question, it's a very important issue. The only question I have is sort of jurisdictional efficacy, which is to say, in what way can the board, this board, either in conjunction or in other manners, or should we, with Dr. Foreman's support and the board's support, make some recommendation to other boards that may have a more direct influence on this? And I, turn to Mr. Nagel to give us some advice about, which part of the township administration might be most effective in dealing with these, real concerns.
As I mentioned earlier, the township has almost no authority in the matter. So it's a matter of relationships and discussions. So the political process, I believe, is the best way to attack it.
So is there a role for us to collect, whether that's through police reports or accident reports, a monitoring system? Again, here focusing on data as the implementation of these things comes through, which I assume we have a little role with changing PennDOT's, initiative.
Our police do maintain accident data. And in fact, one of the things that's great is our data usually is better than the state's because their reporting thresholds are much higher.
Yeah. You mean they're higher in the sense that they're more sensitive?
No, less sensitive.
The state is less sensitive than our police, right? Just to be clear, okay.
Right. So, for example, if the state told me there were 10 accidents last year, the data from Radnor Township probably would indicate there were a greater number of accidents because the state only worries about what are called reportable, and that's where property damage exceeds a certain amount or there are personal injuries. So that information's available to us. Monthly, the police report a tabulation of all those kinds of things, and that's available on the website too.
I guess if that data is available through the police records and we can connect with accident reports and show that it is a significant public health issue that's occurring, then I think it may be within our purview to review, but I'd love to hear what the other members have.
I'm thinking number of ambulances because I work at one of the local hospitals. So would that be something to weigh in? How many are coming from maybe Riddle Hospital, community areas where we get transports from all over?
Well, I think we've already addressed those issues. That's why they're leaving the lanes open for us on that bridge. And obviously, emergency vehicles don't obey the speed limit as it is. So, I mean, the problem here is any data you look at is going to support what PennDOT's action was in all likelihood. Although we can go forward monitoring and see if lower speed limits encourage bad behaviors. So I'm out there driving the speed limit and someone goes zooming by me and has an accident because of that. We could watch for that kind of data. I mean, that would be my approach.
I think it would be helpful.
Just one more thing. I have talked to our state reps. My ward has 2 state reps. And our state senator about PennDOT and the lack of responsiveness, but for what it's worth.
So the good news is that they did change some things based on resident feedback,
yes.
We assume. So is there a role for us to collect this data? Do we have to do anything to collect this data, or is this already actively being collected?
It's actively being collected. Just ask the police for it, and they'll give you a report. And I said, maybe wait 6 months and let's get a report back from them on what's occurred on Bryn Mawr Avenue.
I think that'd be very interesting to really compare and look.
Yeah.
I mean, it's worth it. So let's maybe put that on the agenda for, in 6 months from now and review it.
Not to nitpick, but we're going to have to take a slightly different time frame, John, because hopefully PennDOT will get back to the bridge work sometime within the next 6 months, and that's going to distort whatever data we've got.
It could be a confounding factor, yes.
It will be an extraordinary confounding factor, John. So, yes, we should gather it. I think we'd take a longer time frame. And you are confident that on this occasion, PennDOT are not going to renege on a commitment they have or have not given you with respect to keeping the bridge open?
I have no reason to suspect that they won't keep the bridge open. They've come back to us twice already asking us to revisit the subject. We've been steadfast, and the last we heard from them, it was a done deal.
Any indication as to when the road work is likely to start?
Initially, they had said end of May, but that was the best date, and that's the best I have.
Okay, good, thanks.
I just have one quick question, and maybe you can answer it. And excuse my ignorance, but is there some sort of vehicle between Philadelphia County, Delaware County, Montgomery County, Bucks County that have representatives from each one of the counties and some of the townships to discuss traffic issues and communicate via something? Is there any vehicle to where people are talking within our?
I'm not aware of any. I know that there are intermunicipal meetings with our police. In fact, I participated in one with Lower Merion not too long ago about County Line, because we're having a real problem with accidents on County Line and speeding in the section between Lancaster and Bryn Mawr Avenue.
Okay. All right, thank you. Dr. Capuzzi, did you want to talk about the update on chicken proposal?
So I just wrote up some possible guidelines for a potential chicken ordinance, and they basically, I think minimal compliance and regulation as far as chickens goes is probably what's in order. And the guidelines I put together sort of decrease the burden of chickens on neighbors and on the township, and safeguard the welfare of the chickens. So basically, I think that written notification, if somebody wants to get chickens, they've got to give written notification to the township. They intend to house chickens along with specifications as far as, their setup and the number of chickens. I think, and I just sort of picked an arbitrary number of chickens should really be based on their acreage. Maximum of maybe 6 hens per acre, no roosters, because that would be a noise disturbance. I think they need to provide a hen house, barn, or shed that's adequately large enough for the number of chickens that are going to be in there. They should provide a fenced area of at least, maybe 20 by 20 feet for chickens to free range for at least an hour a day. They need to free range. They can't be just indoors the whole time. They do need to free range, and that's for ethical reasons, for their welfare. That I think that they should be housed at least 40 feet from a property line. And chicken owners need to understand that the township can come onto their property and inspect their setup at any time unannounced and may require modifications. And I also don't think that disposal of the manure should be done in a way that creates use of non-biodegradable things like plastic bags, and certainly should not be the township's problem for disposing. So it should be recycled in a biodegradable manner, either on their property, as used in gardens, fertilizer, whatever. But certainly that's the only disposal method that makes any sense, is on their property or on a friend's property who wants to use it for their garden. So, any thoughts?
I think this is terrific, thanks. I mean, this is what we've been trying to get to for a long time, but what would be the minimum space in a hen house? I mean, do we have like a formula we could provide?
The hen houses that are marketed specify the number, a range of the number of chickens. So there are a zillion different hen houses that one can purchase, and they all give a range of 4 to 8 chickens. And also there's variation, huge variation, depending on the size of the chicken. I mean, chickens can range in size from tiny bantams to, very large chickens. So to say, that's why they give a range. That's why the hen house manufacturers give a range. And also if it's a shed, that's totally, different story. If it's a garage, if it's, some people have old barns on their property. So, but that's a great question.
My only question is, have we thought through the, who is going to be doing this inspection from the township level?
Add to your restaurant inspection responsibilities. No.
Okay. So we'll fall on the health inspector.
Well, and then the other question, of course, is, we've already got a lot on everybody's plate, and so it's a great question. How do we enforce these rules? These are really good, really, I think, fair. As someone who grew up in New York City and doesn't know anything about raising chickens, so I leave that to you. But my question would be, how do we enforce that? And then how do we provide the time and funding for such enforcement? Is there a role for a license? Is there some kind of a permit, as in, say, a fishing license or something like that, that allows for this to be funded and enforced? Because I think the rules are important. It's just how do we logistically get that accomplished with the limited resources that we have here?
My thinking is that less is more, and that once people submit their applications and the applications are, approved, and they, that it's not necessarily regular inspections, but if a problem becomes apparent, the township, reserves the right to make them get rid of their chickens or make them make changes. But I do kind of think less is more here. We're not going into people's houses and telling them how to take care of their dogs and cats. By the same token, I don't know that much needs to be done with chickens, as long as they're in compliance with these general guidelines, and that it's not interfering with neighbors, and that they're not putting big bags of manure for Radnor Township to deal with every few weeks. I think those are the important things.
On the less is more theme and manure, dogs and cats probably generate a fair amount of manure at the moment. And I may be the only person in Radnor who puts some of his used cat litter in the weekly pickup. Why would we discriminate between chickens and kittens and dogs when it comes to disposal of the manure?
Well, that's a great question.
I believe our codes, you're not supposed to dispose of cat litter or dog waste in the trash.
How is it supposed to be disposed of, John? Because educate me.
I guess you dig a hole in your backyard and compost it.
I'm fortunate. I have a big backyard.
Yeah.
And I can certainly do that if now that I understand that is the law. I have got plenty of room to do that. But I doubt that I'm the only person in Radnor who's putting cat litter in the garbage.
I agree with you 100%.
So I'm just wondering, do we really need that one?
Well, especially consider the good citizens
Let's
that
just-
actually do pick
Well-
up after their dogs.
Yeah, well, they pick it up. But
Where does it go?
does it go down the toilet? I don't know where it goes.
No, they
I
put
don't
it-
have a dog. I have cats.
I don't either, but they put it in the trash.
So again, it's the less is more. Do we need this? Do we need that final piece?
Well, I think we have to stick with code,
I don't know.
Stick with code
but
and then leave it to Larry to enforce it?
I guess I'll say this, with chickens, after, after a few months, there is a lot of manure, and it's very heavy. And, I mean, it's.
With a St. Bernard's,
Now-
after a week, there is a lot.
You can put it in the garden. It makes great fertilizer. It's, nitrogen laden. It's.
So let them do
it's-
it. Let them do it.
That's a great idea.
It's such a
I wouldn't put no in a garden.
No, not cat.
All sorts of
No.
problems with that.
Yeah.
So there's a practical way to dispose of it.
So speaking of the weight of the manure, Larry, how much of a weight would this put on you in order to execute this moving forward in terms of enforcement? And I think this is the important part of this to me is, you could say the less is more important is this goes on the Radnor Township website. They have an obligation to say maybe just notify the township, as you wrote in here, and then there are guidelines that are meant really to educate, right? And then the residents have an idea of what the township guidelines are, so that if a neighbor or another resident were to say, hey, they're not following those guidelines, there's
Right.
some rubric for which the town to say, hey, these are the guidelines, they're published, they're available, we expect you to follow those, and here's a letter, reminding you of them. And if that's the purpose, then I think that's fine. So that's the question, and then how much of it would actually be, just to kind of look at this and say, okay, well, the township may inspect, or, the language we could change to say may reserve the right to inspect if complaints filed or something like that, which then takes away your obligation to inspect as a township, right? Because let's just say something happened, then the town would not want to assume any liability in failure to inspect. And so with limited resources, that would be the only comment that I make, is that we consider very carefully on the board whether we would put that burden on the township.
Certainly, it would raise a challenge, because if you're going out to do an inspection of the chicken where it's going to be living, it's manure, you get it on your shoes, and then you have to go do a food safety inspection. Now you're going to contaminate that food facility. So it's something to be thought out. Like my
From a
mother
time
used-
perspective, Larry,
Like my mother used to say, it's more than a notion.
Yeah, I'm not proposing that regular inspections be done, but that that the township has the right to come onto somebody's property and check it out if they become alerted to a potential problem.
I'm not thinking it's Larry's job, but maybe, I like the idea of wording it as such that we reserve the right to inspect, so it's not a mandatory or scheduled inspection. So if there is a complaint, there may be, most people are pretty compliant, but might be somebody with extra chickens, and, it's the right of the citizens to have somebody come and look at it.
I think it would be analogous to the example you gave before of people with cats and dogs. That Larry doesn't go out looking at everybody's house that has cats and dogs.
I think there's value to having a rubric and a common understanding of the way this should be managed. And I think as a first step to do that, I think it's important. To have that somewhere within the township guidelines as a reference point to settle disputes between neighbors and concerns for the public health and the public good. So I think it's fine. I think we just have to, really know what our intentions here are for this. Are there fines? What's the teeth on these?
I think there probably should be a fine if somebody has not submitted something in writing. If somebody has a chicken coop on their property, has chickens, and hasn't submitted something in writing. I do think the township should have a log of where the chickens are housed in the township.
Does that require any additional vetting or approval from the township?
It would be part of the process when you develop the ordinance.
Would this be something for the Board of Commissioners to look at?
We probably would send, once you make your recommendation, it would probably be forwarded to Planning Commission, actually. One of the reasons I've supported this all along is the fact that there are chickens in Radnor, don't fool yourself. And that currently, under our ordinances, that's illegal except in ag, isn't it, Larry? AC, which is ag conservation. And knowing that it actually is a very popular thing right now, it seemed appropriate to me that we should address it so that it doesn't make everyone guilty, but also, as you said, provide some guidance for folks. So that's why I've been very supportive of this. I think it would be very useful. And then it would just fit in with the normal course of the codes. And many of our codes are enforced by complaint. So if, you take noise. You live in a 5-acre plot and play your radio loud, nobody really notices. But if you live in R5, it's very likely the police are going to get a phone call.
I guess it would be sort of analogous to burglar alarms. You have to register your burglar alarm, but that doesn't mean the township is going to people's houses to inspect, your burglar alarm system or anything else. But when there is a problem where it's going off, then it is addressed. So, yep.
So the only issue with fines, however, is that you have to give people the right to an appeal. And so as long as there's a process in place and that we have that in infrastructure and obviously employ the appropriate process to get it enacted and we have those things, we just have to think those things through that, it's not that, there's got to be a whole process to deal with those issues. And then I think maybe even adding this on to a place on the website where they could file a complaint that went to Larry, and then we could deal with it as they arose.
Is it the view of this board that chickens pose an additional health hazard that is not encountered by other pets? Any particular illnesses that are prone to be transmitted to humans or anything else?
Poultry carries, has chickens, ducks, geese. They all carry certain respiratory diseases that can be transmitted to people who are immunocompromised, but flock outbreaks are not common, and they're not going to be an issue with somebody who has 4 or 5 chickens. And salmonella is a non-issue in healthy chickens. It's more of an issue with the eggs that we buy that come from the commercial manufacturers than it would be for backyard chickens. So no, I would say no.
So presumably that would imply that there'll be consumption of eggs from the chickens is the intent.
I think that would be the main reason. I doubt people would be using them for meat, but I don't think we should regulate that.
Or just pets. But so you're
For pets, yeah.
So is the view of this board that chickens to be used as a food source for constituents is something that you think is acceptable, and you would recommend that we permit that?
I think most people would be using them for their eggs. Yeah, fresh eggs.
Is there any minimum acreage that you have in your guidelines there for one chicken?
I just put arbitrarily 6 hens per acre. Seemed to make sense to me.
So that means 3 hens per half acre, or are you going to specify only certain zoning categories that would be permitted that would you'd have to tie it to a size?
Yeah, I mean, that's, I think, something we have to kind of nail down.
Well, Sarah gave us several good ordinances from other communities that we can use as models.
Yes.
And the setbacks alone are going to limit the size of properties that can have
Yeah.
chickens.
And a lot of those ordinances have such detail.
Oh, yeah.
And, you know, I think, again, less is more. I don't think we want to get into that detail. I think if somebody's going to be housing chickens, they should have a minimum of 4 just because of how chickens are with each other. You really need 4 minimum because they get into issues, behavioral issues. And then beyond that, I think that I think that shouldn't go over a certain amount for a certain amount of space.
So are we in a position, John, where we can make a recommendation to the Planning Commission that they take this document and formulate an ordinance?
No, you would make the recommendation to the
Okay.
Board of Commissioners, and then they would, if they agree, then they would send it to the appropriate
Okay, so
boards.
do you think that we are in a position with this document to send it to the commissioners?
Well, I had mentioned to you once before, I think it'd be a very good idea to make a presentation to the board so they know where you're coming from.
Okay. So we need to add in, you want to say they can have 4 chickens minimum?
Yeah, you know what,
Okay.
I'll make some revisions
Okay.
to this.
Okay.
Yeah. And so then when would it be presented?
As soon as you're ready, talk to the manager or talk to Larry, and he'll get it on the agenda.
Okay.
So we need to vote on a recommendation to do that.
She's going to you're going to make a revision and bring it back in June? Is that
So
what
at the next meeting, we'll have a revised copy to then potentially, and Dr. Foreman, I assume, will be here next meeting, so we may.
Or maybe I'll just revise it and send it to everybody, and we could
Sounds good.
make that determination by email? Okay.
Okay.
All right, thank you. Great discussion, good ideas, great feedback. We have a plan. Okay, just a couple of announcements I wanted to make. May is Asthma Awareness Month, so the CDC has some wonderful guidelines. Asthma, a lung disease, affects 24 million people living in the United States, including more than 6 million children. It causes 3 in 5 people living with asthma to limit their physical activity or miss days from school and work. And asthma is also very expensive, costing the nation $56 billion a year. So Tuesday, May 2nd was World Asthma Day, and for resources and how you can take action and get more information, the CDC is a plethora of wonderful information to look at. Secondly, the CDC talks about Healthy Vision Month. So Vision Health Initiative, and May is Healthy Vision Month. So you may have a comprehensive dilated eye exam to check for common eye problems. If you haven't had an exam in a while, you want to get one. And it talks about different links that you can get an appointment for vision health. And it says, although older adults tend to have more vision problems, preschoolers may not see as well as they can. Just 1 out of every 7 preschoolers receives an eye exam, and fewer than 1 out of every 4 receives some type of vision screening. So they recommend, the U.S. Preventative Services Task Force recommends vision screening for all children ages 3 to 5 to find certain conditions. And lastly, coming upon the spring and the wonderful weather we're having in summer, skin cancer awareness. So the CDC has some really good recommendations about skin cancer prevention, seeking shade, covering up with clothing to protect exposed skin. We all know wearing hats with wide brim to shade our face, head, ears, and neck, wearing sunglasses, and then using sunscreen with an SPF of 15 or higher. Really does help prevent things. And they say tan skin is damaged skin. So any changes in color of your skin, whether sunburn, suntan, can lead to skin cancer. So just some tips. Any public participation before we end tonight? Any comments from anyone? Okay. Are we finished? Okay. Adjourn the meeting. Thank you. Thank you.